Hello and welcome to another quick blog summary for the Cancer Physio. As per usual, I create my blogs and content based on the questions I've been getting in clinic. And so lately there's been some questions around bone metastases, how to detect it, and how to exercise safely with it. And so I focus the content on that one today. So once again in the blog here, there's a link at the top where you can just watch this quick video, and then there's a link here for the guidelines. And so these guidelines are in consolidation with the information that's been provided by international working groups that release new information on what is safe and recommended for people with bone metastases. So by clicking on that, it will take you straight to the guidelines in the blog. And then at the top of the blog here, we have kind of the top questions that I get asked. And each of these is a direct link to those questions. So patients often ask, how can I detect bone metastases? Like, what do I do if I'm concerned about it? What are next steps? How can I differentiate, bone mets pain from other types of pain? When do I worry? When do I not? And how can I safely exercise with bone mets? And so each of those questions are really common. And then every single one of these questions, if you link, you will be taken to the kind of correct part of the blog that helps you to answer those questions. So what's tricky with bone mets is that often we're reactive instead of proactive, unfortunately. I see this a lot with the breast cancer population that I work with, that it isn't until there's a pathological fracture, often in the hip, that metastases is detected. So we're trying to get better at having conversations about it now and giving patients tools to help to be prepared and proactive. And the unfortunate thing is that if an X-ray is recommended, because we finally get to that step, it isn't until 40 to 50% of bone loss occurs that it would actually even be found on an X-ray. So bone scans are most sensitive with a 97% accuracy. CT scans are best for proximal femurs and the pelvis. Obviously, not surprising, MRIs are gold standard. So within the public system, patients and obviously physicians have to balance accessibility, cost with gold standard. So it isn't as simple as just getting MRIs for everyone. But I try to share this information so patients can decide for themselves if they want to pursue private imaging. Obviously, bone mets can go undiagnosed for some time, and that can be a really difficult thing because then we can end up being in a situation where we have a pathological fracture. So bone mets, as you know, kind of occurs because one of the tumor cells will break off and transport to your bones and start to metastasize. So imaging is one way to prevent or to diagnose and survey. But another way to do that is blood work, because elevated calcium levels in your blood, hypercalcemia, can sometimes be an indicator that bone metastases is happening. So blood work is another tool that we'll often recommend for patients if we've screened to the point where we're concerned. Most common areas of bone mets are ribs, pelvis, and spine. Symptoms of bone mets, this is where it can get a bit tricky. Sometimes there's just swelling or tenderness in the area, persistent bone pain, weakness, or numbness. So, a patient will come in and we have to use, as cancer physios, our clinical reasoning to determine if this is metastatic or if there are signs and symptoms that this might more just be musculoskeletal pain. So there's a few different tools we can use as we assess to determine next steps. Obviously, we like to catch the symptoms of bone mets at those top three to avoid fractures with minimal trauma, because fractures means that the bone mets has probably gotten to a point where it's beyond 50% for a fracture to have occurred. So it's not uncommon for patients to worry a lot after having a cancer diagnosis with any symptoms after, abdominal pain, hip pain, back pain. Patients are always trying to kind of triage when to worry and when not to, and that is very normal. So hopefully with some of these tools I'm giving you today, you can understand a little bit best what to do in different situations and how a cancer physio can help. So we know that if patients are having pain, they can consider the following. If you're having persistent pain in your back, neck, or pelvis or other areas for more than 3 weeks, those symptoms are unchanging, they are worse at night, the symptoms are very steady, maybe they get worse, but they don't fluctuate with kind of ups and downs and sharp pains, they're very steady. and there was no known mechanism such as a fall or a slip. I would consider really right away seeking clinical help. That can look like booking an appointment with your medical oncologist, your family physician, or a cancer physio in a timely manner. We can then decide next steps. We can do a thorough assessment to understand if this pain is a red flag. Should imaging be considered? Should blood work be considered? And so we really do encourage patients to come in if they fall into that criteria. We know that the prognosis for bone mets actually varies a lot now in today's day and age. With current improved biophosphonates and systemic therapies, there are patients that are living long-term with active metastatic bone cancer that is stabilized and living with a high quality of life. So that's really exciting to see those innovations. And I do have patients that I've been working with for years, exercising regularly and safely throughout this and maintaining their quality of life. So the role of exercise in managing bone mets, this is the exciting stuff. We know that exercise is medicine and it doesn't stop with bone mets. There was a time 20 maybe years ago, maybe even 15 years ago, that there was probably a lot more recommendations around just being in bed and being very gentle and not really exercising. And so the conversation has changed to promoting movement with bone metastases. And so it's all about understanding what those guidelines are and what is safe. So we know that exercise obviously has numerous benefits, and here's a link to some of the top questions I get asked as a cancer physiotherapist around cancer and exercise. And obviously, there are innumerable benefits when it's done safely. Just to highlight a few, we know that exercise with bone metastases can really help with pain management if done correctly. We know that exercise releases hormones that are anti-inflammatory and pain-killing. And this is similar to cold therapy. My previous blog, there's a link to it right there in this blog. I speak to the benefits of cold therapy with cancer, and obviously one of those benefits is pain management. Exercising with bone mets also can improve mental well-being. As we know, movement is medicine, and it can help with brain health and just general feelings of well-being. We know that also exercise with bone mets can improve or stabilize bone health if done safely. This is where we need to really think about the type of exercise. We need to have some clinical support to assure that the type of forces going through the area of metastatic cancer are safe and are not too much. And so this is where with bone metastases, we aim to promote safe resistance training by minimizing the compressive forces and the torque forces through the area of metastases. So we need to consider biomechanics when we are thinking about which exercises to prescribe. But if the exercise is done safely, then we can have improved bone health and stabilized bone health. So that is a really added value of exercising with bone mets. And general benefits of exercise also include boosted circulation, reduced swelling, all that good stuff that we know we've all experienced, generally just within the healthy population. And then, of course, one of the most important values of exercise, and this is where the conversation has really changed, is that even if there's some risk with exercise, if done safely, that risk is less. And the overall benefit that patients with bone metastases receive of improved function transfers over into improved quality of life, and that just outweighs everything. So when a patient can put their pants on, get out of bed, go for walks, walk their dog, enjoy dinner and sitting at the dinner table, with their family, these are things that make quality of life. So we know that exercise improves function and helps us to maintain it, and that is super important for quality of life. So here's the kind of meat of the blog of how to exercise safely with bone mets. And these guidelines are a summary of the international working group that has consolidated and updated the recent guidelines. We know that exercise and bone mets, it is something with which you should seek clinical support. So within our organization, we obviously utilize the expertise of cancer physios. Cancer physiotherapists such as myself can assess your bone health, can understand the area of metastases, can understand the type of metastases, your cancer diagnosis, and take all these kind of moving parts, biomechanical knowledge and anatomical knowledge, and take all that expertise and create a program that is safe and effective for you. We also know that aerobic exercise, should be low impact, but weight bearing when able. So you don't have to just jump into the pool right away and only go into the pool if you have bone mets. We actually prefer load and weight bearing activities such as walking and cycling because you're going to have more benefit to your bone health. However, I do have some patients that unfortunately, walking or cycling is too pain limited, so we opt for pool therapy. And in that case, pool therapy still has innumerable benefits of circulation and joint health and mobility and mental well-being. So there is a role for the pool. And here in the blog, you can see a link that I just speak to the general benefits of pool therapy for those with cancer. But when able, we do prioritize weight-bearing activity. And then so that's kind of endurance activity and so on. And so the other component of exercise, of course, is resistance, which is strength, which is muscle mass. And resistance exercises should be with caution and or support. So we just need to consider, once again, the type of metastases, the area of metastases. Take that knowledge and think about biomechanics, think about the forces going through that area, and select exercises that are appropriate for that patient's health history and diagnosis. Because some types of strength training and some specific exercises actually might be more risk than reward. Stretching and kind of range of motion exercises, general mobility, of course, will benefit joint health, but once again, we need to kind of bear in mind the type of stretching and the forces going through the joints, and then just provide information that's specific and safe for that patient. And last but not least, it is recommended that patients with bone mets avoid high impact sports or contact sports. I do have patients who choose still to downhill mountain bike and, do the things that are meaningful for them. And once again, that's still where cancer is a very personalized journey. So there's no room for shame. These are just recommendations and guidelines. And at the end of the day, quality of life looks very different for everyone. But for most people, the risks of pathological fracture are too high when we bear in mind kind of higher impact sports or contact sports. So we do recommend that patients opt not to exercise with those kind of sports. So all in all, yes, bone metastases can be a debilitating condition, and it can be extremely painful and limit someone's quality of life. But we're also starting to see amazing innovations in the medications and systemic therapies that can help maintain longevity with metastatic bone cancer. And exercise is another one of those tools that we've come to understand can greatly help with quality of life. So once again, here at the Cancer Physio, we're here to help you to understand your personalized plan and an exercise program that is personalized and safe for you. And once again, thank you for your interest in science and rehab.